Welcome to Graper Harper Cosmetic Surgery. I'm Dr. Evon Zoog. Today, I'm going to walk you through your consent form for blepharoplasty. If you have any questions while reviewing this form, please enter them in the portal below, or feel free to ask them in person if you prefer. I want to give you a clear picture of what this surgery is meant to improve. Blepharoplasty focuses on refreshing the upper eyelids, lower eyelids, or both by removing or adjusting extra skin, muscle, and sometimes fat around the eyes. It can help soften puffiness, reduce heaviness, and improve a tired appearance. In some patients, especially when the upper lids are very heavy, it may also help improve vision. It is also important to know what it does not correct. This surgery does not stop aging, remove crow's feet or dark circles, or raise the brows. So, you know what to expect. Let me walk you through how this is typically done. Your surgical plan is tailored to your anatomy, your goals, and whether the upper lids, lower lids, or both are being treated. Once you are prepared for surgery and anesthesia has been given, I place carefully planned incisions in the natural eyelid areas so I can remove or reposition tissue and improve contour. For some patients, extra support to the lower lid may also be recommended if there is looseness in that area. The goal is to create a smoother, more refreshed look while preserving normal eyelid function. We will already have reviewed the exact approach for you before the day of surgery. It is also important that we talk possible risks that come with any surgery. With any operation, there are risks to keep in mind, and this procedure is no exception. Common concerns include bleeding, infection, bruising, swelling, scarring, dryness, discomfort, temporary blurred vision, and changes in skin sensation. As healing continues, there can also be some natural differences from one side to the other. Less common but still important concerns include difficulty fully closing the eyes, irritation from dryness, lower lid pulling away from the eye, delayed healing, contour irregularities, or results that do not fully match expectations. In rare cases, more serious complications can happen, including anesthesia-related problems, blood clots, vision complications, and other unforeseeable complications that I cannot predict. Your recovery can also be affected by your health history, medications, smoking, and how closely post-operative instructions are followed. Even with good healing, some patients may still need additional treatment or revision later on. Now let's look at the potential benefits, along with the other choices you have. One of the main advantages of this surgery is a more rested and refreshed appearance around the eyes. It can reduce heaviness, improve puffiness, and create a smoother eyelid contour. For some patients, it may also help when excess upper lid skin is affecting vision. You also have alternatives to consider. Choosing no surgery is always an option. Depending on your needs, other approaches may include skin treatments, laser treatments, chemical peels, brow lifting, or other procedures that address eyelid position or the surrounding areas. Each option comes with its own benefits, limits, risks, and recovery, and we review those with you so you can make the decision that feels right. I want to explain what you are agreeing to when you sign your consent. By signing this form, you are confirming that we have reviewed the purpose of this surgery, what it may improve, its limitations, the possible risks, the alternatives, and the recovery involved. You are also confirming that you have had the chance to ask questions and that those questions have been answered clearly. You understand that results vary from person to person, that healing takes time, and that no exact outcome can ever be promised. You also acknowledge that anesthesia has its own risks, that additional treatment may sometimes be needed, and that following your pre-op and post-op instructions is a key part of your recovery. To finish up, I want to leave you with the main points to remember. This surgery can improve loose skin, puffiness, and heaviness around the eyes to create a more refreshed appearance. In some cases, it may also help when upper lid hooding affects vision. At the same time, it is still a surgical procedure, which means there are real risks, recovery responsibilities, and limits to what it can achieve. Please take your time reviewing this form carefully and make sure all of your questions are answered before moving forward. You can now sign this form by scrolling down to the bottom. Please enter any required initials, dates, and signatures requested. You will be emailed a copy of this form as soon as you submit, and the office will receive a copy as well. Thank you, and we look forward to taking care of you.